Hello, my name's Kendra. I'm the speech therapist that evaluated Justin today. So today we gave Justin the Golden Fristo. And basically what this does is it looks at his speech sounds and tells us, what errors he's making. So we looked at his sounds in words, and we did that by giving him some pictures and he named them for us. And we also looked at his sounds in sentences. So here's Justin's scores, and a really good way to look at his scores is on this bell curve. So basically this bell curve shows us where Justin falls and kind of compares him to his peers. So right here is the normal range where most of Justin's typically developing peers would fall. The average score for someone who's typically developing on this test would be 100. As we can see, Justin got a 55, so he's going to be about right here, and it is in this severe range. For his sounds and sentences, he got a 77, so he's going to be about right here and in that mild to moderate range. So now I just wanted to tell you a little bit more about the errors that we've seen specifically. We did see some articulation errors. So articulation is basically how he's producing the sounds. So how he's moving his tongue, how he's moving his lips. A good example of something we've seen was he was lateralizing his S. So basically what that means is whenever he makes the S sound, air is escaping out the sides of his mouth a little bit, and it sounds a little funky, So that's something that we could work on in therapy to improve. Another type of error that we were seeing was phonological errors. So basically phonology is not necessarily how we're producing that sound, but it deals with the patterns of our sound and the rules of how we use sounds. So some things that we've seen in terms of phonology was that he was often dropping or replacing the last sound in words often. So instead of pig, he would say pick, and instead of red, he would say ret. And it's not necessarily that he can't say that G sound in pig or that he can't say that D sound in red. It's that he doesn't have that pattern down for the last sound in that word. We also seen that he was replacing F and V sounds for P and B sounds. So those are some more of those patterns that we were seeing consistently during the testing. Some other things to note is I noticed you said that you think he has some motor planning problems, and he has trouble like blowing out candles and things like that. So that's something we want to look into further. It could indicate something like apraxia. I'm not sure if your other speech therapist has mentioned this to you, but it's basically, it deals with our brain sending signals to our mouth and our muscles. And sometimes there can be a little bit of a disconnect with that signal, which can cause us to have problems getting our messages across. In this case, Justin's having problems just moving his mouth in general. So, do you have any questions for me?
Yeah, so why does he have the speech sound problem?
That's a really good question. So we don't exactly know what causes these speech sound disorders. So we do know there are some risk factors. Just the fact that he's a boy kind of increases his risk because it's more prevalent in males. Also, just family history. So if anyone in your family has experienced a speech sound disorder, that increases his chances. And maybe genetics, like they think there may be a genetic link that could cause speech sound disorders. But overall, we really are not sure, but there's a lot of research going on to try to figure that out. Do you have any other questions?
Yeah, so will he get better? Like, what's going to happen with him?
Yeah, so based on testing today, Justin did really well. He was really attentive to the task, he was really motivated, and I think that gives him a really good outlook. So, and also by you going and seeking out services so early, and him being in birth of 3, now he's in preschool speech, I think that really improves his chances of catching up with his peers.
Okay.
Thank you.
Thanks.